Good afternoon and welcome everyone to the Senate Committee on Health and Human Services for the 83rd Legislative Session. Madam Secretary, please proceed to call a roll.
Senator Lang, Senator Stone, Senator Taylor, Senator Titus, Chair Doñate.
And I'm here. All members are present. Good afternoon and thank you everyone. Happy deadline day. We have a few items today on our agenda. We have a hearing on Senate Bill 425 followed by a work session that we have to get through. I'm going to do a few housekeeping announcements and then I'm going to go pass the gavel to our vice chair so I can go ahead and present Senate Bill 425. A few housekeeping items. Please note that there are a couple things for today. If you wish to testify, you can sign in at the table by the front and provide a business card to our committee secretary. If you do not wish to testify, you may also want to sign in so that there's a record of who is interested in participating on a particular bill today. When testifying, you can turn the microphones on to speak and off to listen, and we have listeners in Las Vegas and viewers online who are watching this meeting. For those of you that would like to participate, we ask that public comments be kept to 2 minutes so that everyone interested in speaking can be accommodated and we can get through the agenda in a timely fashion. And finally, we ask for folks to please turn off their electronic devices, especially their cell phones, and put them on silent during the meeting. We will start today with our bill hearing on Senate Bill 425, followed by our work session. And so at this time, I will go ahead and open the bill hearing on Senate Bill 425 and pass the gavel over to our vice chair.
Okay, thank you very much, Mr. Chairman. As he said, the hearing is open for Senate Bill 425, so please go ahead when you are ready.
Thank you, Vice Chair and committee members. For the record, Fabian Doñate, proudly representing Senate District 10. Today, I'm here before you to present on Senate Bill 425, which makes revisions relating to healthcare professions. A little about the background of this bill. This is an interim bill that we passed during the last year. It was passed by the committee members speaking about how we can improve the efficiency of our government and making sure that we're responding to the needs of our constituents. The bill establishes several provisions. The inspiration was taken from Senator Doc Hardy, who pursued this type of legislation previously. And then obviously we took components of what has been passed in Utah through the other legislatures. And so I'm going to go through the provisions of the bill, and then I'm happy to answer any questions regarding the specifics of it. It does look like a big bill, but the components of it are actually fairly small. And so I want to go through that process now. So, sections of the bill. Section 6 of the bill establishes the State Office of Healthcare Workforce and Licensing within the Division of Public and Behavioral Health of the Department of HHS, and it requires the administrator of the division to appoint the director of the office. Sections 2, 4, and 5 define certain terms relating to the office, and Sections 3 and 10 establish the applicability of those definitions. Section 7 requires a director to perform certain duties relating to healthcare workforce in this state, including, among other things, work to establish criteria and goals of the development and diversification of the healthcare workforce and provide support for the Advisory Council on Graduate Medical Education and implement graduate medical education grant programs. Section 8 authorizes the director of the office to accept gifts, grants, and donations. Section 9 of the bill establishes an account for the State Office of Healthcare Workforce and Licensing to support the activities of the office. Section 7, 11 through 15, 17 through 20, 85 through 101, 106, 110, 115, and 121 and 128 transfer the authority of the office to oversee and implement certain data collection and reporting activities relating to demographics and practice conditions of providers of healthcare and physicians concerning their employment. The office will also assume oversight of the physician visa waiver program. Section 145 eliminates certain unnecessary definitions, and Section 16 makes a conforming change to eliminate a reference to those definitions. Section 7 and 26 through 32 transfers oversight of the Advisory Council of Graduate Medical Education and the responsibility for carrying out the GME from the Office of Science, Innovation, and Technology to the State Office of Healthcare Workforce and Licensing. Section 32 also revises recipient of an existing report concerning the grant program to additionally include the Director of DHHS and Administrator of the Office. Sections 33 and 44 through 49 authorize the state treasurer and various entities within the University of Nevada that are responsible for the student loan repayment for providers of healthcare in underserved communities programs and various programs within the University of Nevada to improve the healthcare workforce, to consult with and request assistance of the Director of the State Office of Healthcare Workforce and Licensing. Section 146 eliminates the boards. So this is the actual meat of the bill, so I'm going to just go a little bit slower this time. Sections 146 eliminates the boards of psychological examiners, examiners for marriage and family therapists and clinical professional counselors, examiners for social workers, alcohol, drug, and gambling counselors, and applied behavioral analysis. And Section 63 now creates the Board of Behavioral Health Professionals within the State Office of Healthcare Workforce and Licensing to replace the licensing boards eliminated by Section 146. Sections 43, 102, 108, 111, 116, and 123 transfer the responsibility for regulating psychologists, marriage and family therapists, clinical professional counselors, social workers, alcohol and drug counselors, problem gambling counselors, behavioral analysts, assistant behavior analysts, and registered behavior technicians to the Board of Behavioral Health Professionals. Section 70 requires the board to submit to the legislature and each regional behavioral health policy board a report currently submitted by certain licensing boards eliminated by Section 146 that contains information concerning investigations, disciplinary actions, and applications for licensure. Section 60 through 62 define certain terms relating to the board, and Section 59 establishes the applicability of those definitions. Section 63 through 67 prescribes various requirements concerning the membership composition, procedures, training, and compensation, and records of that board. Section 68 requires a director of the State Office of Healthcare Workforce and Licensing to manage the finances of the Board of Behavioral Health Professionals, and Section 69, 113, and 119 authorize the director to maintain offices and employ persons and enter into contracts on behalf of the Board. Section 25 exempts the Board from certain requirements relating to financial records and legislative audits that normally apply to professional licensing boards because the board will not be responsible for its own finances. Sections 38 through 42 subject the actions taken by the director regarding budgets, employees, and contracts to requirements that generally apply to state agencies. Sections 71 through 76 establish 3 advisory committees. Number 1, the Qualifications and Professional Development Advisory Committee, the Background and Investigations Advisory Committee, and the Probation and Compliance Advisory Committee, to advise the Board of Behavioral Health Professionals and assist with certain duties. And Section 77 establishes provisions governing the appointment and procedure of those advisory committees. Section 78 authorizes the State Office of Healthcare Workforce and Licensing to establish additional permanent or temporary committees to advise the Board concerning any aspect of its duties. Sections 21, 22, 24, 34, 35, 37, 43, and 50 through 57 through 79 through 84, 104, 109, 113, 126, 127, and 129 make various conforming changes to ensure that the board assumes the powers and duties of the licensing boards that were eliminated by Section 146 and is otherwise treated similarly to those of those licensing boards. And number 2, that the legal status of those behavioral health professions is not changed by this bill. Sections 23, 36, 37, 104, 109, 113, 114, 118, 120, 122, 125, and 146 make additional conforming changes to remove the references of the eliminated boards from these sections that are not applicable to the board. And number 2, that the provisions that are duplicative of Sections 63 through 70 are no longer applicable. Sections 103, 105, 107, 112, 117, and 124 make conforming changes to clarify the applicability of certain provisions of existing law. Sections 130 requires the director of the State Office of Healthcare Workforce and Licensing to collaborate with the Board of Behavioral Health Professionals when performing certain duties relating to healthcare workforce, and number 2, to provide support to the board. And lastly, Section 137 requires DPBH to develop a plan for transferring the duties of the licensing boards eliminated by Section 146 of the board, present and adopt the plan at a separate public meetings, and to notify the governor and the legislature and the licensing boards of the date of the planned transition at least 90 days before the date. So, just as a quick summary of what the bill is doing. Through Section 146 of the bill, we are consolidating a few of the commissions or boards of commissions that deal with the licensing of certain behavioral health groups or professions. Under this, right, because you are combining them, we are now having 3 advisory committees, as I defined, right? One that deals with investigations, the other one that deals with other provisions in terms of what happens when you recognize issues coming forward with these types of professions. There's a conversation of qualifications and professional development, which is also captured as part of this bill provision. We mimicked the bill exactly the way that Utah has implemented their behavioral health consolidation, with the understanding that we are now essentially establishing an Office of Healthcare Workforce and Licensing under DHHS. This is a proposal. I know that there are other bills that are looking at consolidation of professional licensing requirements and so forth. This is a proposal that is specifically looking at healthcare, and it's specifically looking at behavioral health. It does not apply to other professions, as in physicians or nurses, right? We are only talking about behavioral health. And the goal, right, is if we do this bill right, and if we do it small, then we can identify the shared resources that healthcare professions may need, and then ultimately down the line, we can ensure that we are no longer hearing complaints of delays in licensing and so forth. And so I think this was a unique response that was supported bipartisan through the committee, that we wanted to streamline some of the licensing requirements that was applicable so that people don't have to go to different ways, that we're starting off with the same infrastructure, and that we're expanding essentially our resources to provide more support towards especially those in our behavioral health sector. So obviously it's a pretty complex bill, but in simple terms, all we're doing is we're combining a few of the behavioral health professions into one board so that people have an ease of going through the applications and so forth, while increasing the infrastructure that could come with such office. So Vice Chair, at this time, I'm happy to answer any questions that the committee members may have.
Okay, thank you, Chair. We will bring it back here to the committee for questions. We'll start with Senator Titus.
Thank you, Madam Vice Chair, and thank you, Chair Donate, for bringing this forward. It is long overdue. It is something that we've talked about, occupational licensure reform, and I like your approach of taking it a step. It is something we talked at length during the interim on doing this, so well done. I do have a question, however. You did speak that it's the behavioral, certain behavioral licensing boards that we're combining, but you also are bringing out the Advisory Council on Graduate Medical Education. So I want to make sure, and I certainly support that. I have a GME bill, those kind of things, and that Advisory Council was going to be moving around. We knew. I want to make sure that it's consistent with what Senator Pazina's bill had done, and that there's no conflict in that.
Thank you so much, Fabian Oñate, for the record. Thank you so much, Senator Titus, for that question. So the bill was drafted. So if you recall, during the interim, we voted on this transition. We did not anticipate Senator Pazina's bill. That has already been work session, and so my goal is to pass this bill today, knowing that it's going to go through finance, and then we can delete that at a later date, assuming that Senator Pazina's bill moves forward.
Right. That's my only, after I looked at this and spent a little time, and thank you for sharing it today, that would be my only question. So I appreciate that, and thank you. Great work. Well done. Long overdue. Thank you.
Thank you, Senator Titus. Senator Stone?
Thank you, Mr. Chairman, for bringing this forward. As you know, I saw this just a little while ago. Can you just clarify about the professions that are being consolidated? Will each of the professionals have a seat at the table, if you will, on the new commission?
Yes, thank you so much, Fabian Oñate, for the record, and I think our legal counsel can also help us with this. So yes, so essentially what we're doing now is, so obviously Section 146 is the main one that starts to consolidate and eliminate these boards. So again, just for reference, because I know it's a lot of content that we have to digest, the boards that will be eliminated will be the psychological examiners, the examiners for marriage and family therapists and clinical profession counselors, the examiners for social workers, alcohol and drug and gambling counselors, applied behavioral analysis, and then Section 63 of the bill will now create the Board of Behavioral Health Professionals within the Office of Healthcare Workforce and Licensing. And so The following sections essentially move the regulations already to this new structured board, so they don't have to promulgate new regulations. But this new board is going to have the membership essentially consolidated of all of those. So I can't remember the section from the top of my head, but maybe our legal counsel can respond to that.
Eric Robbins, LCB Legal, for the record. Yeah, the section that talks about the makeup of the board is section 63. And so there are 6 members, or there are several members. The first set of 6 members is just a psychologist, marriage and family therapist, clinical professional counselor, clinical social worker, clinical alcohol and drug counselor, or alcohol or behavior analyst. The 6 members have to be one of those. And then there are 2 members who have to either be a social worker, master social worker, independent social worker, alcohol and drug counselor, problem gambling counselor, or assistant behavior analyst. And then there are a few more spots for various stakeholders who aren't licensed behavioral health
And
professionals.
Fabian Doñate, for the record, that's page 46 and 47 if you want to follow along. Yeah.
Do you have any other questions for the chair at this time? My only question, Chair, and again, thank you for bringing this bill, is you said it consolidates some of the behavior health professions, not all of them. Can you talk about that a little bit?
Thank you so much. Fabian Doñate, for the record. Sorry, what I meant to say is we are specifically looking at the professions that deal with behavioral health, but there are other folks that work in healthcare that are not affected by this bill. So, for example, the Board of Medical Examiners and so forth, we are not touching them. We're only touching the ones that deal with behavioral health.
Okay, thank you for that clarification, Chair. Seeing no other questions, Chair, we'll invite you to step back, and then we will open up the floor for any support testimony for Senate Bill 425. Anybody who would like to testify in support of the Senate bill here in Carson City or I don't see anyone in Las Vegas, but there may be someone on the phone line. Please come forward at this time. Any support testimony? Seeing none here in Carson City and no one's there in Las Vegas. AVH, on the phone line whenever you're ready.
Vice Chair, there are no callers at this time.
Okay, thank you so much. And now we'll open the floor for any opposition testimony. Any opposition testimony for 425? Seeing, well, here comes someone. Come on forward. It's okay. Please make sure you state your name, spell your last name for the record, and then you'll have 2 minutes.
Good afternoon, Chair Doñate and members of the committee. My name is Victoria Erickson, ERICKSON, and I'm here today to testify in opposition to Senate Bill 425 on behalf of the Nevada Board of Examiners for Social Workers. SB 425, while well-intentioned, would fundamentally disrupt the integrity of our board's mission and decision-making process and may lead to the termination of its leadership and subject matter experts. The bill suggests that DPBH will create increased transparency, accountability, and efficiency, yet nothing has been provided to suggest the actual steps for any of this and the cost associated. In fact, this bill is being heard today shows a lack of transparency by DPBH. We have had no communication with DHHS or DPBH around this bill. If the concern exists about this board's operations or accountability, we believe that it should be addressed through open dialogue, not unilateral legislation. SB 425 puts much of the board's responsibility to include qualifications and professional development, background investigations, and probation and compliance to advisory committees that will serve without compensation. This bill threatens the very independence it allows the occupational board to serve the public interest and ensure public safety without undue political influence. If the legislator's concern is transparency or oversight, we welcome collaboration to improve communication or reporting mechanisms. But SB 425, as currently drafted, undermines the fundamental governance structure of our board and can impair our ability to operate effectively in the public's interest. For these reasons, I urge this committee to oppose SB 425. Thank you for the opportunity to testify.
Thank you, Ms. Erickson. Is there other opposition to 425? Seeing none here in Carson City and no one in Las Vegas. AVH, we'll go to the phone lines when you're ready.
Vice Chair, there are no callers in opposition at this time.
Thank you so much, AVH. And now neutral testimony. Any neutral testimony here in Carson City or in Las Vegas? Okay, seeing none. AVH, did the callers sneak in that short period of time?
Vice Chair, there are no callers in neutral at this time.
Okay, thank you so much. We appreciate that. Mr. Chair, please come forward. We do have another question here from the committee.
Senator Nate, I wanted to see if I heard this right, that this bill actually came out of an interim committee, which they happened 9 months ago, and then that's how it came to be. Is that correct?
Thank you so much, Fabian Donata, for the record. That is correct. The language for this was approved in a public manner during the interim committee, which was back in August. And so that was work session, and the bill has been public as well for some sort of time since it's been introduced. And so it's not, it just came out of nowhere, right? We've known that this was coming for several months now.
And when it passed out of committee, you said it passed unanimously?
Fabian Donata, for the record, that's correct from my recollection.
Great, thank you.
Thank you so much, Senator. Any further questions while we're here? Any closing comments, Chair?
Thank you so much, Vice Chair. I just want to make sure that I provide this on the record. So obviously, we are in the deadline day, and so I would ask that we work session the bill. I know that I've had some preliminary discussions with a few of the boards talking about if this is not the proposal to go through, then maybe it's a shared infrastructure, right? For example, there's concerns of there's duplication of portals and so forth that folks have to build out their own infrastructure for applications to be received and processed. Many boards still operate on paper, right? And so there are a lot of considerations in terms of shared infrastructure that could exist, whether this proposal is the final product or not. And so I would just ask folks that if there is a worry and so forth, that they can work with me offline, because the bill still has to go through finance. So it's not going to pass and become law tomorrow, right? We still have a lot more time, but given the fact that we're on deadline day, I would ask that we move this bill forward. So thank you so much.
Thank you, Chair. We have a request for a motion here with Senator Lang.
Yes, thank you. I move that we do a due pass for Senate Bill 425.
There is a motion for a due pass for Senate Bill 225 from Senator 425 from Senator Lang. Is there a second? Oh, let me close the hearing first. Ha. The hearing is closed. Now we close the hearing on Senate Bill 425, and now we'll open it up for a motion. Senator Lang.
Thank you, Vice Chair. I move that we vote today and do pass on Senate Bill 425.
There is a motion to do pass Senate Bill 425 from Senator Lang. There is a second from Senator Stone. Is there discussion? Seeing none, all those in favor, please indicate so by saying aye. Aye. Any opposition? The motion carries. It is unanimous, and we will assign that floor station to the chair. Thank you so much.
Thank you so much, Vice Chair, and to committee members. Give me 1 second, and we'll pivot now to the work session. We'll go in recess for like 3 minutes. I just need to go through these documents real quick. All right, we're back from recess. Let's go ahead and begin our work session. Let's start with Senate Bill 54. Ms. Cooper.
Thank you, Chair. Destiny Cooper, Committee Policy Analyst, Research Division, LCB. For the record, as nonpartisan staff, I cannot advocate for or against any of the measures you'll hear before you today. Senate Bill 54 requires Medicaid to provide coverage of certain services for persons experiencing homelessness. It's sponsored by the Senate Committee on Health and Human Services on behalf of the City of Las Vegas. It was heard in committee on March 25th. In summary, Senate Bill 54 requires the Director of DHHS to include medical respite care coverage under Medicaid for persons experiencing homelessness, and the Director of DHHS is required to seek any federal waivers to ensure the coverage, and additionally mandates the division within DHHS to develop a model to provide such care. There was an amendment proposed by Senator Doniate that revises the effective date. Thank you.
Thank you so much, Ms. Cooper. Committee members, do we have any questions on this? This is a motion to amend do pass. Do I have a motion? We have a motion from Senator Lang, seconded from Senator Stone. Any discussion on this bill? The only thing that I just wanted to mention is I think that obviously this is tailored to one facility in the state. I want to make sure that as it goes through the process that we are encompassing the flexibility for other portions of the state to also participate. I know there are concerns of the fiscal applicability of that request, but I think it's imperative that we, because it's a 2-3 year process before the federal government can approve a waiver, I want to make sure that we can at least ensure that everyone participates throughout the state. So that's my only ask. Senator Titus?
Thank you, Chair. That's exactly what I was going to say and express my concern. Certainly, the policy is very good, but I'm very concerned it was limited to one specific place, and we know that this problem exists throughout our state. Thank you.
Thank you so much. Any other comments? Moving on to the vote. All those in favor, please say aye. Aye. Any opposed? Motion's carried, and I'll go ahead and take that floor statement. Let's move on to Senate Bill 118. Ms. Cooper.
Thank you, Chair. Destiny Cooper for the record. Senate Bill 118 revises requirements relating to coverage under Medicaid for certain services provided by pharmacists. It's sponsored by Senator Stone. It was heard in committee on April 10th. Senate Bill 118 expands Medicaid coverage to include services provided by a pharmacist if those services are also covered when performed by other healthcare providers, and ensure pharmacists are reimbursed at the same rate as other providers for performing similar services. Additionally, the bill eliminates the need for prior authorization when a pharmacist provides a service that is already covered if performed by another provider. No amendments were proposed for this measure. Thank you.
Thank you so much. Committee members, any questions? This is a motion to do pass. Do I have a motion? We have a motion from our Vice Chair. Do I have a second? A second from Senator Stone. Any discussion on this bill? All those in favor, please say aye. Aye. Any opposed? Bill passes unanimously, and I'll sign that floor statement to Senator Stone. Congratulations. Let's move on to Senate Bill 192. Ms. Cooper.
Thank you, Chair. Senate Bill 192 revises provisions relating to public health, sponsored by Senator Neal, and was heard in committee on March 27th. Senate Bill 192 provides several provisions relating to healthcare access and policies. Among other items, this bill requires hospitals and freestanding birthing centers to provide a qualified sign language interpreter to patients giving birth and allow a family member and doula in the room. Requires Medicaid and other insurers to cover doula services for maternity care and includes doulas in their provider networks. Requires schools to adopt policies on preventing sudden cardiac arrest during the participation of sports, prohibits a health carrier of health insurance or a health insurance administrator from providing healthcare services directly to patients or operating or administrating any entity that provides healthcare services directly to patients. Senator Neal proposed an amendment. The amendment can be found attached. Excuse me. In addition, there's two friendly amendments that I would like to bring your attention to. They're not all in one document. In summary, removes provisions relating to non-compete agreements, exempts certain plans from the requirement to cover doula services, removes provisions related to the expansion of dental services, and adds reporting requirements to sections related to testosterone coverage for menopausal women. Thank you.
Thank you so much, Ms. Cooper. I'll give a few seconds just to digest the information. I know that Senator Neal is still obviously working on this legislation. It's a pretty comprehensive bill, and so this is a motion. Well, first of all, do I have any questions on it? This is a motion to amend and do pass. Do I have a motion? We have a motion from our Vice Chair and seconded from Senator Lang. Any discussion, Senator Titus?
Thank you, Mr. Chair. I think there are components of this bill that I like, components that I just cannot accept. It's very broad, and I appreciate the intent, and I appreciate Senator Neal always looking out for her constituents in the state. But again, this is way too many subjects here that I cannot accept, so I'm going to be a no, thank you.
Any other comments? Let's move on to the vote. All those in favor, please say aye. Aye. Any opposed? We have 2 nays from Senator Titus and Senator Stone. The motion is carried, and I'll assign that floor statement to Senator Neal. Let's move on to Senate Bill 295. Ms. Cooper.
Thank you, Chair. I would like to bring your attention to Senate Bill 295. At the top of the work page, the bill page, it says Senate Bill 29. That is a typo on my behalf. It should be Senate Bill 295. Senate Bill 295 revises provisions related to food establishments. It's sponsored by Senator Donyate, etc. It was heard in committee on March 25th, and in summary, revises provisions related to sidewalk vendors and cottage food operations, defining terms, outlining regulations, and exempting certain establishments from existing food establishment requirements. Among other provisions, this bill requires local boards of health to develop guidance documents, make them available in multiple languages, and establish a task force to advise on sidewalk vendor regulations. Senator Donyate proposed an amendment, which can be found attached, clarifies regulations for sidewalk vendors by narrowing the definition of certain terms, strikes the original cottage foods provisions, and will exempt certain vendors from commissary preparation for a defined list of low-risk, non-perishable food items while allowing local health authorities to enforce food safety standards, including requiring food handler cards, allows limited home storage of carts and flexibility in hand washing infrastructure while maintaining protections for public health and safety, and amends subsection 2I of section 12 to specify it applies to establishments selling only whole produce or prepackaged non-potentially hazardous food items. Thank you.
Thank you, Ms. Cooper. Senator Lang has a question. Go ahead.
Senator Donate, I'm just curious. It took so long to get regulations in for food vendor trucks. I'm wondering if you have a specific time when this has to be done.
Thank you, Senator Lang. I want to go maybe over just really quickly what this amendment will do, because then I think that would answer the question that you're providing. So there are obviously a lot of the amendment considers deletions, and I want to thank, of course, our health district folks for helping me with this process. I think it's been very hard for both sides, not to say the least. But the main thing that we actually, the main provisions of the bill that is Section 10. Section 10, as you remember in the original bill, looked at cottage food regulations. So we were trying to add items onto cottage food. That provision has now been strucken from the amendment. What we're doing now is that sidewalk vendors who sell food are still going to be continued to subject to provisions as a licensed food establishment. So rather than a registration as we were proposing, they still have to go through a license as is required. And so the cart that they're going to be approved for still has to have a hand washing sink and so forth. However, the foods that we have identified, as long as they're shelf stable and there's considerations for time and temperature control, they don't have to prepare it no longer at a commissary, because that was the largest requirement. So they don't have to go to another facility to prepare it. They can prepare it at home, but they still have to maintain the license requirements. They're still subject to investigations and so forth if any complaints come up. And so that's kind of the meat of the bill. And then we also added recommendations from the counties in terms of the revocation of equipment and so forth, just to make sure that the enforcement piece was there for folks that are not following. So that's pretty much it. So it's if this was enacted via state law, it just makes revisions to what is already applied. Any other questions? Let's move on. This one is an amend do pass. Do I have a motion? We have a motion from our vice chair, second from Senator Lang. Any discussion on this bill? Senator Stone.
Thank you, Mr. Chair. I just want to applaud you for the hard work that you put into this bill. And while it's not at the state yet where I can approve it, I just want to let you know that I want to reserve if it moves forward. Okay?
Thank you. Any other comments? Let's move on to the vote. All those in favor, please say aye. Aye. Any opposed? We have 2 nays, one from Senator Stone and one from Senator Titus, and I will go ahead and take that floor statement. Let's move on to Senate Bill 300. Ms. Cooper.
Thank you, Chair. Senate Bill 300 makes revisions relating to Medicaid, sponsored by Senator Dondero Loop, etc. Heard in committee on April 10th, Senate Bill 300 requires Medicaid cover services provided by a psychiatrist, psychologist, advanced practice registered nurse, amongst other providers of health at a federally qualified health center. Additionally, this bill adds a new requirement for Medicaid to cover services provided by a mental health counselor. Senator Dondero Loop proposed an amendment which, in summary, expands Medicaid coverage for mental health services within a FQHC setting to only those with a minimum of a master's level degree. Thank you.
Thank you so much. Committee members, any questions? This one is an amend do pass. Do I have a motion? We have a motion from Senator Titus. Do I have a second? Second from our vice chair. Any discussion? All those in favor, please say aye. Aye. Any opposed? Motion carries unanimously, and I'll sign that floor statement to Senator Dondero Loop. Let's move on to Senate Bill 329. Ms. Cooper.
Senate Bill 329 requires certain persons to complete training on dementia and cognitive impairments, sponsored by Senator Flores, etc. It was heard in committee on March 25th. Senate Bill 329 requires certain emergency medical personnel to complete training concerning identifying and interacting with individuals with dementia and other cognitive impairments in the licensure process. This bill also requires the emergency medical professional to submit to his or her licensing authority proof of the certification on or before October 1st, 2026. Senator Doniate proposed an amendment which is attached. In summary, changes provisions relating to the State Board of Health to the Health Authority and revises provisions relating to training requirements by a national accredited or national certified program with demonstrated expertise. Thank you.
Thank you, Ms. Cooper. Committee members, any questions? You can do a comment, Senator Titus.
Thank you, Mr. Chair. I certainly, in the testimony, heard of the family histories and certainly have dealt with patients with dementia. Certainly have had family members with dementia. But also during the testimony, we heard that these were already policies in place, both with the EMS and our police departments. We've had other bills that are brought forward with complaints that, well, we already do this, and let's have the policies and not put it into NRS. And so for that reason, I'm going to be a no on this bill. Thank you.
Thank you, Senator Titus. Any other comments? This one's a motion to amend and do pass. Do I have a motion? We have a motion from our Vice Chair, second from Senator Lang. Any other discussion? All those in favor, please say aye. Aye. Any opposed? We have 2 nays from Senator Titus and Senator Stone. I will go ahead and assign that to Senator Flores. Let's move on to Senate Bill 337. Ms. Cooper.
Thank you, Chair. Senate Bill 337 revises provisions relating to opioids, sponsored by Senator Lang and heard in committee on March 27th. Senate Bill 337 requires the Division of Public and Behavioral Health to create a non-opioid directive form and post the form on the division's website. This bill also requires certain healthcare providers, insurers, and facilities to provide a person with the opportunity to execute a non-opioid directive. Among other provisions, SB 337 sets forth procedures for a patient to execute and revoke a non-opioid directive, prohibits a person who knows or should know that the person has executed a non-opioid directive from prescribing, administering, or directing the administration of an opioid with certain exceptions, requires the State Board of Health to adopt regulations prescribing procedures relating to the non-opioid directive, among other provisions. Senator Lang proposed an amendment which can also be found attached. It revises the implementation date, removes immunity language in Section 20, removes certain language from Section 36 of the bill, removes Medicaid from certain provisions of the bill, and the effective date for hospitals to institute the new law would be 6 months after state promulgates the required regulations. Thank you.
Thank you so much, Ms. Cooper. Committee members, any questions? This one is an amend do pass. Do I have a motion? I can't tell who did that one.
Give it to Titus.
Okay, there's a motion from Senator Titus. Do I have a second? I think it was a Senator Stone that seconded. Any discussion on this bill? All those in favor, please say aye. Aye. Any opposed? Motion carries unanimously, and I'll sign that floor statement to Senator Lang. Let's move on to Senate Bill 372. Ms. Cooper.
Thank you, Chair. Senate Bill 372 revises provisions relating to the care of children, sponsored by Senator Steinbeck and heard in committee on April 10th. Senate Bill 372 adds to the list of circumstances in which a child is not considered abused or neglected, including when a parent or guardian, 1, seeks to have the child see a mental health professional if the child's behavioral health needs pose a risk to the family, and 2, brings a biological foster or adoptive child into the home with behavioral health needs that pose a risk to the family. No amendments were proposed for this measure. Thank you.
Thank you so much. Ms. Cooper, any questions? This is a do pass. Do I have a motion? Motion from our Vice Chair, second from Senator Titus. Any discussion? All those in favor, please say aye. Aye. Any opposed? Motion carries, and I'll sign that floor statement to Senator Steinbeck. Let's move on to Senate Bill 389. Ms. Cooper.
Thank you, Chair. Senate Bill 389 revises provisions relating to the administration of pharmacy benefits under Medicaid and certain other health plans. Sponsored by Senator Scheibel, et cetera. It was heard in committee on April 10th. Senate Bill 389 requires DHHS to contract with a single PBM referred to as a state pharmacy benefit manager to manage all coverage and prescription drug benefits by January 1st, 2030. Additionally, the bill outlines the application process for applying to be the state PBM, requires DHHS to adopt regulations establishing certain criteria for eligibility, methodologies for reimbursement, and dispensing fees, and requires that DHHS approve any contract between the state PBM and a pharmacy or an entity that contracts on behalf of a pharmacy if the contract is for the provision of benefits under the contract between the state pharmacy benefit manager and DHHS, or any revision, suspension, or termination of such a contract in order for the contract revision, suspension, or termination to become effective. Lastly, this prohibits the state PBM from entering into, renewing, or amending a contract that conflicts with the obligations of the state PBM under the provisions of this bill. Senator Scheibel proposed an amendment which can be found attached and in summary revises provisions relating to the methodologies and reporting. Thank you.
Thank you so much, Ms. Cooper. Committee members, any questions? This is an amend do pass. Do I have a motion? We have a motion from our Vice Chair, second from Senator Stone. Any discussion? Seeing none, all those in favor, please say aye. Aye. Any opposed? We have one nay from Senator Titus, and the motion carries. And we will assign that floor statement to Senator Scheibel. Let's move on to Senate Bill 423. Ms. Cooper.
Thank you, Chair. Senate Bill 423 revises provisions governing public health, sponsored by the Senate Committee on Health and Human Services on behalf of the Joint Interim Standing Committee on Health and Human Services. It was heard in committee on April 8th. Senate Bill 423 revises provisions related to public health, amongst other provisions. It defines a health authority to include county boards of health, health districts, and federally recognized tribes. It creates an account for public health in the State General Fund, administered through the Division of Public and Behavioral Health, applies the first $30 million from a tax on insurance premiums to the account for public health, and requires health authorities receiving allocations in 2026 to develop frameworks to ensure compliance with regulations for electronic health information. Senator Doniate proposed an amendment. I will not read through all of them, but which in summary adjusts the bill language to be in alignment with the original intent of the bill draft request, such that there is a uniform base funding allocation per each county distributed to the health district serving the county, and in the case where no health district has been formed, to the division. It eliminates the per capita funding provision. All funds will be distributed to the statewide base funding for the division and local and tribal health authorities, reduces the funding to the account for public health from the Department of Taxation to $4.925 million per biennium, with the first distribution at the outset of fiscal year 27 through 28. Thank you.
Thank you so much, Ms. Cooper. Any questions from the committee members? This is a motion to amend and do pass. Do I have a motion? We have a motion from Senator Titus and a second from our Vice Chair. Any discussion on this bill? All those in favor, please say aye. Aye. Any opposed? Motion carries unanimously, and I will take that floor statement. Let's go on to Senate Bill 424. Ms. Cooper.
Thank you, Chair. Senate Bill 424 requires an assessment to be imposed on private emergency medical transport providers, sponsored by the Senate Committee on Health and Human Services and was heard in committee on April 3rd. Senate Bill 424 requires the Division of Healthcare Financing and Policy of the Department of Health and Human Services to impose an assessment on private emergency medical transport providers. Additionally, this bill establishes the account to improve emergency medical transportation quality and access and prescribes the authorized use of the revenue generated by the assessment. The Nevada Ambulance Association proposed an amendment, which is attached, revises the definition of emergency ambulance services, removes air ambulance as part of the provisions, and outlines rate increases for emergency private services. Thank you.
Thank you so much. Committee members, do we have any questions? This one is a motion to amend and do pass. Do I have a motion? We have a motion from our Vice Chair. Do I have a second? Second from Senator Lang. Any discussion? Moving on to the vote. All those in favor, please say aye. Aye. Any opposed? We have 2 nays from Senator Titus and Senator Stone. The motion carries, and I'll take that floor statement. And last but not least, Senate Bill 434. Ms. Cooper.
Thank you, Chair. Senate Bill 434 creates a program to award grants to address shortages of providers of healthcare. It's sponsored by Senator Canizaro and was heard in committee on April 8th. Senate Bill 434 establishes the statewide healthcare access and recruitment grant program known as SHARP, managed by DHHS to address healthcare provider shortages. Among other provisions, SB 434 requires, starting in 2027, the state controller to transfer 0.5% of anticipated state revenue annually unless the account balance exceeds a certain amount. It requires the department to perform a biannual assessment to identify shortage areas, authorizes certain entities involved in the provision of healthcare, governmental entities, and certain nonprofit organizations to apply for a grant of money from the account to support a project to address those critical shortages. Senator Canizaro proposed an amendment which can be found attached. In summary, the amendment broadens the definition of certified area of need to include clinical services and expertise, in addition to providers of healthcare. It prohibits the transfers to the SHARP account if the balance of the rainy day fund has a balance of less than $1 billion, and allows DHHS to utilize 1% of funding for costs associated with administering the program. Thank you.
Thank you so much, Ms. Cooper. Committee members, do we have any questions? Senator Titus?
Not really a question, but a concern. First, I appreciate what this bill is trying to do. I certainly think we need conceptually the policy I like. I do not like the funding option given, in that it will divert money, in my mind, from the rainy day fund, as opposed to using a fund perhaps, as I had mentioned earlier, maybe some interest in the rainy day fund, something along those lines, as opposed to diverting money from that would typically go into the rainy day fund. I think it's a slippery slope that we would be starting, and there's no other evidence that this has ever been done before. And for that reason, I'm going to be a no. Perhaps I'll come around as further discussion happens. Thank you.
Thank you so much, Senator Titus. Any other questions or discussion? This is a motion to amend due pass. Do I have a motion? We have a motion from our Vice Chair, second from Senator Stone. Let's move on to the vote. All those in favor, please say aye. Aye. Any opposed? We have a nay from Senator Titus, and I will go ahead and assign that floor statement to Senator Canizaro. That concludes our work session for today, which means that we can go to our last item on the agenda, which is public comment. If there's anyone that would like to provide public comment, you may come forward at this time. I don't see anyone here or in Las Vegas. AVH, is anyone online?
Chair, the public line is open and working. However, there are no callers at this time.
Thank you so much, and thank you to our committee members and to our staff for helping us get to this moment for our first committee passage deadline. That concludes the work for today, and the meeting is now adjourned.